Hi, everyone. Good morning and welcome to County Executive Pittman's virtual press conference. This morning, the County Exec will share updates on the county's food and household good distribution efforts and on COVID response. We'll take questions after these updates. As a reminder, please keep your camera off and microphone off unless you're called on to ask a question. We'll be taking questions in order after the updates. Please put your name and media affiliation in the chat and I'll call on people in that order. With that, Mr. County Executive.
All right. Thank you, Jeff. Thank you, everybody, for joining us this morning. I'm going to start out this morning by signing a bill. And this is a bill that normally we would not do a public bill signing for, but because it's a routine government function, when the county council passes a bill to accept outside funds to support the residents of Anne Arundel County. But Bill 8921 was a little different, both in that it was extremely important to accept $5.4 million of funds from the State Department of Health to Anne Arundel County Department of Health for vaccinating children, working to continue to combat and finally beat this pandemic, as well as programs to address opioid addiction in the county. And it would normally be fairly routine, except that we came precariously close to not passing this bill when 3 of our council members voted no on it. Councilwoman Hare, Councilwoman Fiedler, and Councilman Bulkey all voted no. Fortunately, the 4 council members that voted yes, Councilman Pruski, Councilwoman Pickard, Councilwoman Rodvian, and did I just do 3? I can't even remember which one. Lacey, thank you. Councilwoman Lacey, all voted yes on this bill. The letter did go to the State Department of Health requesting that they educate the council further, especially the 3 council members on this. And our health officer sent a letter to the council as well, offering to further educate them. They do sit as the Department of Health for Anne Arundel County. And so it's absolutely essential that they understand the importance of these programs. So I am going to go ahead and sign the bill, accept the funds. Thank you to the state of Maryland. Thank you to the council members who voted to support this bill. I also want to acknowledge that COVID rates are up somewhat in the county, and we have a holiday coming up, and encourage folks not only to be vaccinated, but if they're having family gatherings, to get tested. And we fortunately in Anne Arundel County have tests available for free, both at our senior centers and our libraries, and the supply at grocery stores and pharmacies and other department stores is better than it was a few weeks ago. So my family, for instance, has got a bunch of folks coming in from out of town, and while we're all vaccinated, we are all going to get tested, some in advance with PCR tests, some with rapid tests when they get here, just to have that extra layer of protection and knowledge that nobody is carrying the virus. So I encourage others to do that as well. And then finally, it's with Thanksgiving, we have so much to be thankful for, but one of the things is that in Anne Arundel County, we're able to feed folks who need some help in difficult times. And I want to acknowledge the amazing work that so many of our nonprofit organizations and churches have done during the pandemic and since, and are continuing to do and are doing this week. We have invested $9 million of county funds, both from the CARES Act money, for half of it was from CARES Act federal money, $2.5 million of the American Rescue Plan federal money, as well as a couple million of county general funds for our nutrition assistance, both distribution and particularly about half of all of that to the Anne Arundel Food Bank to increase the supply of food. So a distribution network has been created, and I just want to thank everybody for their hard work on that as we go into this holiday season. And I also want to just thank the workers who have, particularly the lower wage hourly employees who are working through the holiday and who have been most affected by the pandemic. Thankful that wages at the low end of the wage scale, the hourly workers' wages have increased, and thank the small businesses who employ those folks. It's been a difficult time, and I believe we're coming out of it and doing much better. So we have lots to be thankful for, and we live in the best place for all. So I'm thankful for that as well. But I do want to turn it over to Dr. Kalyana Raman, who can talk about boosters and some other COVID-related matters.
Thank you, County Executive. So I want to start with just where we are. As the County Executive noted, we're seeing a rise in our case rate. We're seeing that in other parts of the country as well. But I think really importantly, we have the tools to be able to handle this. What we all need to do is continue applying them. And so I'm going to start off with our vaccines. Boosters, of course, kind of top of mind. As we've continued to note, with some vaccines, your immunity decreases over time and you need a booster shot. We do that with the flu shot. That's why we have a yearly flu shot. And we're finding the same thing with COVID vaccines. So last week, the CDC updated their recommendations, which is what we've been hoping to see from them. And the recommendation is that everyone 18 and older who got the Moderna or Pfizer shot should get a booster shot if it's been more than 6 months after your second shot. So if you got your second shot sometime in mid to late May or before then, it's time to get your booster shot. And what we're finding is that it's really effective in boosting your immunity. And some studies show that the protection gets even stronger. So please go out and get that. They're readily available. Health department sites, pharmacies, doctors' offices. You can get the same vaccine, you can switch. The most important part is to get the booster. And of course, if you've had Johnson & Johnson vaccine, everyone should get a booster 2 months after their one dose, and that recommendation hasn't changed. Also want to encourage you to get your 5 to 11-year-olds vaccinated. We see that over 20% of the kids kids who are 5 to 11 in the county have gotten their first dose. That's fantastic. We want to continue to see parents getting their kids vaccinated. It is safe, it is effective, it is free. We're continuing to partner with pediatricians' offices, particularly to get them vaccine doses so that you can get your kids vaccinated, whether it's a health department side, pediatrician's office, pharmacy, whatever is most comfortable for you. Lastly, I want to talk about Thanksgiving. It's very different from last year. We have a lot of much more ability to keep everybody safer. Get your first shot or get your booster. It's still the holiday season. Even if you think it's too close to Thanksgiving, that's okay. People are getting together during December, during the Christmas holidays, the winter holidays, whether you celebrate Christmas, Hanukkah, Kwanzaa, or any other faith tradition. It's not too late to get your shot. But I think importantly, if you're sick or have any symptoms, don't host or attend a gathering, and get tested if you have any symptoms of COVID-19 or close contact with someone with COVID-19. And then particularly for those who are using public transportation, please make sure you're wearing your masks during that, and consider getting tested if you have been around others who are exhibiting any symptoms. If we consistently apply those principles, we'll be able to have a much safer holiday and get together with all the people we want to get together with. So with that, I'll turn it back over to you, County Executive.
All right, good. Jeff, questions?
Sure, folks, again, if you could put your name and media affiliation in the chat if you've got a question, and we'll call on folks in that order. Not seeing any questions. Might be wrapping up a little bit early for the holiday week. Last call for any questions. Amy Simpson, Fox 45.
Hey, good morning, everybody. I wanted to follow up with a question about the ongoing effort for 5 to 11-year-old vaccinations. I know we're only about 2.5, almost 3 weeks into this. I'm wondering if Dr. K or even the county executive could give some insight into the ongoing demand for that. Initially, I know that there was an expectation that there would be outpaced demand for at least initial supply.
So we are seeing that there are spots available at health department sites. What we're finding is that parents want to talk to their pediatrician or other health professionals much more than adults who are looking to do so, and there are also a greater desire to get the shot at their pediatrician's offices as well. So there is availability right now, but there's also demand in the pediatrician's offices, and so that's why we're transferring those doses, more of those doses to the pediatrician's offices.
Great, thanks so much.
Joel McCord, WYPR.
Yeah, thanks, Jeff. I'm wondering, you both spoke of the COVID rates being up somewhat. I'm wondering if you can quantify that. How much is somewhat?
Back up around 17, is that right, Dr.
So we're
Perry?
about 15. Our case rate's at about 15, at least as of yesterday. It had gone down to as low as 11. And what we typically find is that there's a bit of a lag in terms of hospitalizations once that case rate starts going up. That's why it's really important, and we're kind of keying in on the boosters, is because we don't want people to think just because you got the vaccine, January, February, that it's the same protection level as in the first few months. We really do need to get people boosted because these case rates are going up.
Okay, thank you.
Dana Monroe, Capital.
Do you know by the difference between the jump in cases this time last year versus now from, I don't know, maybe like a month ago to pre-holiday season?
So are you asking to compare pretty much this year, this time to last year?
Yeah.
Okay. So it's a similar case rate, but a very different scenario. I think the big question we have is, what is the case rate rise going to look like over the next couple of months? Because remember, this year we have a lot more activity. There are no restrictions. Whereas last year we did have restrictions in place. School wasn't in place in person. And so, to have a case rate like this comparable to last year with a lot more activity means we're actually in a much better spot than last year. And what we want to do is continue to be able to do all of this, but do it safely. So we're anticipating that we won't see a rise in the case rate as much as we saw last year, but that's dependent on everybody continuing to do what we know we need to do.
Got it. Thank you.
And I would just add that in addition to looking at the actual numbers of cases last year, we were looking at hospitalization projections, and it was a very dire picture that we were looking at, that if action had not been taken on restrictions, we didn't have a vaccine at that point. So we were looking at our hospitals being overwhelmed with COVID patients, and thanks to the vaccine, that's not where we're at now. There are no projections that suggest that that's going to happen.
Great. Thanks.
All right, last call for questions. Name and media affiliation in the chat if you've got a question. All right, we'll wrap up. Happy Thanksgiving, everyone.